Hi, my name is Christina Johnson. I'm going to be doing a video on trach care today. I have a couple of extra supplies, not very much, but enough to maybe get me through this. First, I am going to check the patient's chart, make sure that they have an order for trach care. Even though you see that the patient is there and has a tracheostomy, you want to make sure you have the necessary orders. Anyway, here we go. I am going to knock on the door, introduce myself, make sure I identify the patient. I am going to wash my hands. I'm going to come in with my supplies. So I have my supplies here, and I have a pair of gloves here also, in case I need them. So I've come in with my supplies. I am explaining the procedure to the patient. I'm going to go ahead and change your inner cannula on your trach, and I'm going to change the dressing and the neck piece. I am going to first assess their respirations, assess if they need suctioning. They don't need suctioning. They've just recently been suctioned. And I'm just going to go on from there. I'm going to go ahead and close my door. I am going to ask the patient first if they are in pain. My patient is not in pain, so I do not need to give medications. I'm going to go ahead and adjust the bed height, waist height for the nurse in a comfortable working position, get my bedside table together, and from there I am going to go ahead and proceed. For this specific, I don't know, I'm just going to use this for our neck piece for the trach because I don't have anything else to use. I'm going to wash my hands since I just touched my face. Try not to touch my face in front of the patient. I'm going to put on a face shield. I am going to go ahead and put on some gloves. I've washed my hands. I'm going to go ahead and get my little sterile field set up here. I don't really have much to work with, so this is what I have to work with. Generally, you would open this. Let's do it the correct way. I would open it this way. This is my clean field, and then this is going to be my sterile field. I'm going to open my inner cannula first. I'm going to move this a little bit more out of my way. Open my inner cannula first. Set it down so where I'm not touching anything inside of the kit. This has been open because I've used it, but we're going to open this also. And open from front to back and let it go ahead and set. I have my gloves. I have clean gloves on, so I'm only going to touch my packaging, the outside of the packaging, and I'm going to set those here. I am going to go ahead and take off the mask. I am going to secure the outside part of the trach. I'm going to go ahead and squeeze the however their trachs are put in differently. There's different, depending on the type of trach the patient has, but you're going to go ahead and maneuver this out. And the patient is fine. We're going to go ahead and throw this out in the trash since it's dirty. I'm going to wash my hands really quick. We are going to go ahead and open up our gloves. I only want to be touching the outside inch of my sterile gloves because that way it keeps everything sterile. I am going to pick up this glove on the inside here. No, I'm going to pick up this one because this one's got to go on first, since I'm right-handed. I guess it doesn't really matter what glove you put on first, but, and then we're going to pick this one up and put this one on. I didn't put them back in the package right, sorry. And I just ripped my gloves, but that's okay. We'll work with it for demonstration purposes. I am going to go ahead and pick up the new trach cannula. I don't have to hold, the patient's okay, he's steady. I'm gonna go ahead and pick up the new trach cannula. And I don't wanna really touch the inside, even though I have sterile gloves on. I haven't touched anything else, so we wanna make sure this remains sterile. We're gonna go ahead and hold this. We're gonna pop this in. And then we're gonna go ahead and put no, I'm not gonna do that. That's popped in. So for right now, I'm gonna go ahead and remove the dressing that is already on the patient. Since this part needed to stay sterile, it's done. I can use both hands as I need to. I'm gonna go ahead and remove this dressing with this hand. And I don't have a dressing on there, but we'll remove the dressing with that hand. I am going to go ahead and move this out of my way because I don't need it. We can drape that across the patient if we need it. I have put sterile water in here. I am going to grab a Q-tip, wet it. I'm going to clean the top, toss this. Let me get another Q-tip, wet it. I'm going to clean the bottom. Make sure that there's no ulcers, bleeding, anything like that in there. As long as everything's good, we're okay. We're going to go ahead and put a new dressing up under there. And for right now, I'm going to go ahead and put the oxygen back on the patient just to get it up there. And we'll work around the oxygen for now to get the collar put back in place. For right now, I'm going to go, usually you would use 2 nurses for this. I don't have a second nurse, so I'm just going to go ahead and oxygenate the patient for a second, make sure that they have oxygen, monitor their O2 sats. Since it's just 1 nurse, I'm going to go ahead and take the oxygen back off since they've gotten some oxygen. And I am going to go ahead and get my new collar, my little makeshift collar here. And we're going to get this ready. And then I'm going to go ahead and I'm going to hold this and remove the Velcro on this side. While the Velcro is removed, I'm going to go ahead and put this new piece on here and secure it. And then I'm going to go ahead and pull this around the patient. I don't like reaching around the patient, but for this purpose, I will reach around the patient. We're going to go ahead and unvelcro. We still are holding this in place. We're going to move this around. I'm going to reach around the patient again. Like I said, I don't normally like to do that, but I will for this purpose. Since it's just me, normally you would get a second hand for this. You want to make sure that it is nice and flat. We're going to go ahead and stick it through, Velcro it, and then it's in place. We want to make sure that we have 2 fingers of room in there just to make sure that the patient, it's not choking them, because that would be uncomfortable. And ask the patient if they can move their head up and down a little side to side. If it's comfortable for them, then we've done what we need to do. If it's not comfortable, then we need to make sure that we adjust the collar as needed for their comfort. As long as it's maintaining their O2 sats, we're good. I'm gonna go ahead and put the oxygen back on the patient. Make sure that they're not in any pain, because it can cause pain depending on the patient. And then just thank you for allowing me to do this with you. I hope if you need anything, make sure you use your call light. We're gonna adjust the bed to however they're comfortable. And then I'm gonna go ahead and clean up my mess. And all this would just go in the trash. And that, I think, is what I need to do, I think. I don't think I missed anything. Generally, you would not be reaching over your sterile field at all because the cross-contamination, for this specific purpose, I don't have I didn't have a bedside table or a second table that I could use for this, so this is what I had to work with. Assess their vitals, make sure that they're breathing fine, make sure their oxygenation is fine, and I believe that is it. I hope I didn't miss anything on this one. Yeah, and that would be it. I would take my gloves off, wash my hands, and excuse myself from the room. Thank you.